Good afternoon, everybody. Thank you all for being with us on this pretty sunny Wednesday afternoon. It belies what is apparently coming for this weekend. So cold weather, maybe some snow, but you know they'll refine that forecast as it goes. So today we're going to talk about COVID. We're going to talk about the numbers. We're going to talk about vaccinations, and then we're going to take your questions, whatever's on your mind. We're going to talk with you about that. So let me begin by talking a little bit about the COVID numbers. They continue to be better. Yesterday, City of St. Louis had 69 new cases. Now that's the highest it's been for a week. Our average number of new cases for the last week, though, has been 53 new cases a week in the city of St. Louis, and that's 18 cases per 100,000 population. That compares, that 18 cases per 100,000 population is still better than anybody else in the region. St. Louis County is at 32, the state of Missouri is at 25, St. Charles is at 21, Jefferson's at 26. So everybody is a lot better than we were a month ago. So that's good news. Similarly, hospital numbers. Currently hospitalized, this is for the region, you know this is the four major hospital systems, BJC, Mercy, SSM, and St. Luke's. As of 2 days ago, because these numbers lag 2 days behind, there were 529 people in the hospital COVID positive or suspected of being positive, 529. A week ago, on the 25th of January, it's a little more than a week ago, the number was 629. So that's good. Number of people in ICU as of 2 days ago in the region is 109. Number of people on ventilators is still 82. So that's still a pretty high number, but not as high as it was when it was up. I'm looking back a month and it was 125 or higher. So those numbers are much better. They still do not meet our guidelines, which let me just go through those one more time. Our goal is 0, right? But our goal to really reconsider some of the things we're doing is to have new cases in the city of St. Louis of 35 per day. We're at 53. Hospital admissions in the region at 40 per day. We are at 7-day average, we're at 61, so we're 50% higher. Number of people in the hospital in the region, goal is 350. We're at 529 today. And the positivity rate, the goal is 5% or less. And today in the city of St. Louis, we're just under 8%, 7.8%. So we're doing much better. Numbers are much better than they were a month ago. And, it's been a pretty steep decline. And I think, people have just really, when the numbers were so terribly high in December, end of November and in December, and we had a lot of additional deaths. So far in the city of St. Louis, we've had 353 deaths from COVID. And frankly, most of them occurred early on in COVID before we had as effective treatment for it. But so within this last few weeks, the numbers have really improved significantly. So keep it up. Don't get together with your 100 best friends to watch the Super Bowl, please. Because we know that after every sort of holiday or party time, there is an increase in cases. We hope that won't be the case this time. The other thing that we know is that right now the R naught, if you remember that term, is about 0.8. And so what does that mean? That means if the R naught is 1.0 That means one positive case of COVID infects one other person. So that's an even. That's not growing. It's not declining. The R naught right now, and this is from yesterday's meeting with the Pandemic Task Force, was reported at about 0.8. And so that's accounting for these numbers going down because people are not infecting so many other folks. So that's really it for the numbers. We still have hot spots primarily in South St. Louis, and then one basically in the Central West End area. Those are densely populated areas in both cases. I'm looking to see if I have a map. I might not have that today, but yeah, I don't have it with me today, but it's on our website. You can look at it there if you're interested in really seeing how that shakes out. So numbers are better. Keep up the good work. I think in the city of St. Louis we have all of you are doing a pretty darn good job, and I know it's hard, and I know you are ready to socialize and get out there with friends, but please just restrain yourself a little longer. Because if we can keep these numbers going down, and if we can keep the number of vaccinations going up, which right now is way too low, but we'll talk about that, then we're going to have a situation where hopefully without a big increase in any of the more contagious variants, that perhaps we can really get a handle on this and get numbers back down. And therefore get back to some sense of normal. I don't know that it'll ever be normal like you thought it was before, before last March, but certainly better than what it's been for the last 11 months. So anyway, that is the numbers, and happy to take any questions about those if you have them. Now, vaccinations. I'm going to give it to you straight. There's not enough. There just simply is not enough. The state of Missouri, the whole state, is getting 75,000 vaccinations doses a week. There's 6.2 million people in the state. They each need 2 shots, at least right now. So 75,000 a week is a very low number. The St. Louis region, and this is bigger than what we usually think of as the region, it's the entire Highway Patrol Troop C geography. You can find that on the map if you want. But it includes Farmington and includes Troy, areas that we don't always think of as being in our region. So the entire Troop C area is getting 38%, give or take, of that 75,000. That's based on population. So what does that mean that this Troop C region is going to get per week? It means around 28,000 doses. Of that 28,000 doses that we think this region will get per week, the region's got 2.5 million people in it, or 2.4 million people in it. And we're getting 28,000. So you see the problem there. And of that 28,000, a little over 50%, 53% is going to go to the major hospital systems. And so that's 15,000 doses to them. That's good. The major hospital systems, they have a lot of patients. They have a lot of contact information. It's likely that they will roll out this vaccine. They have been rolling it out to their patients that are old. And when I say old, they're really focusing on 75 and above, not exclusively, but and who have some pretty serious underlying conditions. So how much the city of St. Louis will actually get per week in terms of doses is unknown. I mean, we just simply don't know. You know that last week, a week ago yesterday, we got 3,900 doses. We vaccinated 4,498 people. So let's call that 4,500. So we're able to get 600 extra doses out of those vials. Everybody knows that you can get an extra dose out of about every 2 vials. And I have to just give a hats off to the nurses. We had many nurses. Many of them, virtually all of them, were volunteering, who drew the vials. You know, you'd see them with the vial turned upside down, drawing it out into the syringe. And so they are the ones that really made that happen from 3,900 to 4,500. So we got that 3,900 doses on Tuesday. On Thursday, we started vaccinating our first responders, our police, our fire, our EMS, the people, our corrections officer, the folks who fall into phase 1B, tier 1. We also vaccinated over 1,000 people who were primarily from the registry, and you all know about the registry. Let me just tell you, we've got close to 40,000 people on that registry, but we took people in the order they had signed up. First day was January the 13th, who were over 65 or who said they had an underlying health condition. So we feel good about getting 4,500 doses into arms, but this week, as of yesterday, we got 975 doses. Now, what are we going to do with those? Everybody wants to know. We're holding 450 of them to vaccinate firefighters and police officers who got their dose back about 10 days ago, 10, maybe 12 days ago. So we'll be doing that next Friday. And then we have been assured by the state that we will get another 3,900 doses so that the people who got vaccinated last Thursday, Friday, Saturday will, on the 19th, 20th, and 21st, those are the dates, right? Thursday, Friday, Saturday, 19th, 20, 21. Of February.
Checking.
What is it? What are the dates, Kyle?
19th, 20th,
I'm right.
21st.
19, 20, 21, which will be the Thursday, Friday, Saturday. We'll get those 3,900 doses to be able to vaccinate them. So that's where we are right now. We don't have any idea how many doses the city health department will get. There are 114 health departments around the state that are vying for these doses. We are putting in our request every Monday. We don't know until Saturday if we're going to get anything for the following Tuesday. So this will get better, but the bottom line is this. Everybody needs more vaccine. Every state, every county, every city across the country needs more vaccine. 75,000 doses of the vaccine per week for Missouri is way too low. So that's where we set up a false expectation that, oh, you're going to get it tomorrow, you're going to get it next week. I wish that I could tell you that, but I'm trying to tell you, we don't have the vaccine to give you. If we did, we would do that. So that's vaccinations. It will get better. You know, this feels a lot like PPE originally. Remember when we didn't have any masks and we didn't have any gowns? Then remember we didn't have any tests, and now here we are, and there's no vaccine. There's not enough vaccine in the supply. So I'm not going to tell you to be patient because I know you're out of patience. So am I. But I'm just trying to tell you the facts. So, all right, that's all I've got to say about that for now. Questions?
We have many questions about vaccinations today, Mayor. Okay, so Julie's question has to do with round 2, which, by the way, is the 18th, 19th, 20th. Sorry about that.
Okay.
How confident are we from the state that we will have doses and that folks will be able to get their second booster shot?
We have been assured in writing from the state that we will get those doses, Julie.
We also got a question from Pat. If she is someone, or I shouldn't assume, if they are someone who got a first dose at Union Station, how do I know where I will go, when I need to go? What are the methods of communication that you'll be reaching out to me?
You put your email down on that sheet. We will reach out to you by email. You also put your phone number on the sheet, so we will reach out to you first by email, no doubt, because there's 4,500 people on that list. And then we'll ask you if you're coming back, and then hopefully you'll reply. So that will be, today's what, the 3rd? So we've got a couple weeks, and you'll get something several days before that. But you got a card when you got the vaccination. Hang on, I'm going to grab mine out of my purse, I think. Yep, okay. So the card looks like this, and on the back of it, it tells you what day you're going to show back up. But you're going to get a reminder. Please don't lose your card. If you don't know where it is right now, go through your pockets, go through your purse, wherever you might have stuck it, and find that card and bring it back. That is the quickest way, and we will communicate with you also.
Okay, Judith has a question about the sign-up and registrations. She's eligible, she's in one of the appropriate tiers, she's joined the alerts, still have heard nothing. What's your recommendation on what those folks should do and where they're supposed to go?
Well, I think I just went over that. We don't have the vaccines. I don't know. We took folks in order. We're being very mindful of trying to make sure that we're able to vaccinate people that maybe aren't on smartphones or maybe aren't on. So we're working through all of that. But right now, we don't have any doses. Now, I do recommend sign up with your wherever your doctor is affiliated, BJC, Mercy, SSM. I would sign up on all of those lists as well. I was at SSM this morning, and they were giving a lot of vaccinations there. They were actually vaccinating a lot of county, or a lot of police officers who police in one of the county districts. I spoke with a couple of officers there who work for the Postal Service. So SSM is doing a lot of that, but the hospitals are the ones that we expect to get 15,000 doses a week. It's not going to be enough when you consider there's 2.3 or 4 million people in this area. But if you meet the criteria, you're more likely to get a call. Some folks are also looking. The National Guard in the state is doing various sites around the state. We could post that for you. I actually have the National Guard list. I think today, or it's in Farmington.
It started today.
In Farmington, because that's Troop C geography, and you do have to have appointments though for all of these places. St. Louis County, I think, did their first event today. Is doing it today at Florissant Valley. So you have to just continue to look, but understand it's not about you. It's not that anybody's rejecting you. It's that there just are not enough doses.
Kristen has a COVID-related question. Who's watching? What does the current positivity rate have to do in order with event restrictions to be lifted in the city of St. Louis?
Well, I went through that a minute ago, Kristen. The goal for the positivity rate is 5% or below. We're at about 8% right now. The goal for all these 4 factors have to get in line. 35 new cases in the city, 40 new admissions per day in the hospitals, fewer than 350 people in the hospital, and a positivity rate of less than 5%. So, there are, it's not going to be like turning on the shower, all right? It's not going to go from off to full blast on. There'll be some phase in of that. We all want conventions here. Conventions are a very big economic generator for not just the convention center, but for the hotels, for the restaurants when people go out to eat and, have entertainment. So we all want the conventions to be able to operate again. But we also can't put 10, 20, 30,000 people jammed into a space. So I hope that answers your question.
So based on the limited supply, Jeremy, Lydia, and some other viewers have submitted questions about additional tiers where teachers, educational staff, other vulnerable populations, transit people, are located, are we any closer to getting there or no?
No, we really are not. You know, I guess we're 4,500 doses in the city closer to getting there, but that's no place near close. So look at the state's website. It's very easy to find this. We'll post it. Phase 1B, Tier 2 is where we are right now. And Tier 2 is 65 or older, adults with underlying health conditions as they're listed. Heart disease, COPD, kidney disease, cancer, weakened immune system, diabetes, type 2 diabetes, etc. That's where we are now. In the state of Missouri, 2.5 million people who fall into that category or above out of 6 million, so 40% of the people. So we have a long way to go. And when you think about at 75,000 doses a week in the state, goodness, that's weeks and weeks and weeks before we're through those people. The supply has to increase. It's that simple.
Chris has asked, is the state communicating well with the city with regard on how vaccines will get there and when?
Well, I don't think the state is withholding information. I think they don't know. They've got 75,000 doses a week. They just really found out that was going to be their number in the last week or 10 days. So they have told us that. What we all want to know is, well, when is the state going to get 150,000 doses per week or 200,000 doses per week? If you think about 75,000 doses per week, the Biden administration set a goal initially of having a million shots a day. We have 75,000 in the country. 75,000 doses is not even close to being able to achieve that. So it's a supply side and a distribution side problem that can only be solved by Moderna, Pfizer, those two are the approved ones right now, being able to make more vaccine quicker and ship it. It's the only solution. Now, maybe Johnson & Johnson will get approved, but it's my understanding there's not much supply of that right now either. And so, you know, it's a production issue. So the state tells us what they know. It's just not what we want to hear.
I think we got time for 2 more questions. So you talked about how the state's sending 53% of its supply to hospitals instead of a local health department. Amy's question is, does that mean you would recommend that people sign up for vaccines through hospitals since local public health departments are getting such a local or limited supply? Yeah,
you should sign up everywhere you can. Now, I think it'd be a lot better if we had one big sign up, but we don't. And we got 114 counties in Missouri. I would sign up wherever you can.
Somewhat COVID-related question from Rachel. Today's the last day to register to vote. The March and April elections are coming up. Does the Board of Elections have similar expanded voting options like libraries for people to use to vote early?
The state does not allow the absentee voting as a result of COVID. COVID is no longer a reason that you can vote absentee. Now, that's silly, but that's the way it is. So you can vote right now at the election board absentee if you are, does it tell me if you're going to be out of town, you think you're going to be out of town, or if you are ill or have a health reason that you can't go to vote in person. So I don't think they have libraries, do they, this
I
time?
don't believe so, no.
No, but you can order an absentee ballot, or you can go to the election board and vote. It's my understanding that it has not been very crowded over there. So if you know who you're going to vote for, and you know that you have a health condition where you don't want to be out at a polling place, then go to the election board and vote early.
Okay.
That's it.
That's it.
It's 2:30, guys. Thank you so much. Appreciate you being with us. Thank you for your patience, if you have any. And I understand if you don't. We are doing this 3 times a week. It's been almost a year since we have been doing Live with Lyda every Monday, Wednesday, and Friday. We've missed a few Fridays or a few meetings here or there. But you think about that, we've probably by now done 135 or 40. So that's the reason that we do this Monday, Wednesday, and Friday every week that is possible. And so thank you. Appreciate you being with us.